Do you want to know how to game the American medical system? The answer? Go to the ER. See, back in the 1980s, they passed a law that said anybody who comes to the emergency room has to be evaluated and treated, regardless of if they can pay or if they have health insurance. And so what the emergency room has become is a primary care clinic. But the problem with the emergency room is that all costs in medicine, when you look at all of them, the emergency room accounts for about 1/3 of all costs of medicine because people are using it inappropriately. And to run an emergency room is way more expensive than to run an office clinic. So the emergency room is filled with people using it as a primary care clinic, charging 10 times what it would cost in a regular office setting. And because of that, emergency rooms are overrun. And because of that, emergency rooms are hugely not profitable for most hospitals. Because emergency room physicians, well, they perform the most free services of any physician in America. About 60% of what they do in the emergency room, they never get reimbursed for because the government said they have to treat everybody, regardless of nationality, regardless of if they have insurance, regardless of if they can pay their bill or not. And some of that is very good and some of that is very abused. We need to find a system where people actually have access to primary care doctors, to office-based systems, so that the emergency room is only used for emergencies, only used appropriately. And when people go to the emergency room, the hospitals actually get paid for those services. Because what's happening now is with 60% of those bills never getting paid, that means the 40% of people with health insurance have to pay for all those other 60%. And it's enormously expensive. It's a huge problem. And we try to keep saying that in America we don't ration care and that if we were to have a universal healthcare system, that it would be socialized medicine and all sorts of people wouldn't be taken care of. That is such a lie. All you have to do to demonstrate that lie is to do a very quick Google search of the developed nations on the planet, of which America is the only one that doesn't have some sort of centralized universal healthcare system, and of which the true socialized systems, well, it's really the VA in America, the Veterans Administration, and probably the one in Great Britain. The rest of them are based off of the free market. We need to do our education and see if what the Republicans have called socialized medicine is actually honest, because it's not. They're playing mind games with you. And we need to see if what the Democrats are saying, that everybody should be covered regardless of what they do or how they behave. And no, that's not right either. You and I know that. We need to be able to take care of everybody, regardless of how much money they have, regardless of the color of their skin, regardless of the zip code that they live in. And they need to have good access to basic health care. And statistics like 1/3 of all healthcare expenses happening at the emergency room are going to plummet because people now have choices for not only getting treatment, but more importantly, having preventative strategies that will prevent going to the emergency room in the first place. We also need to hold people accountable for when they're abusing the emergency room. We don't have anything right now to hold people accountable. It's just a free-for-all because honestly, they don't have much other choice. If you want to stop paying for those 60% of people who never pay their bill at the ER, then you need to seriously start considering what it would look like if everybody had adequate access to health care so that we could actually have life, liberty, and the pursuit of happiness. Our healthcare system right now, it is solely geared toward making corporations money and giving our politicians power. And the systemic discrimination that results in that is truly a crime for the richest nation that ever graced this planet. Our system, it needs to be of the people, by the people, and for the people, so that when the people need something done, they don't go through medical bankruptcy, but they also don't bankrupt the American medical system because they have no other choice. Please, my ask of you, whether you're shaking your head or nodding your head, don't trust anything I say. Do a Google search on some topics and get educated. You will be amazed at the inequalities that we have. The late, great Martin Luther King had this quote: "It's time that we heed his warning, that we heed his angst, and it's time that you and I change it for the better." To learn more common sense solutions, to learn how you can personally get involved, and to be the change you wish to see in the world, subscribe to this channel, and we'll let you know when new videos are out. Please also check out the book I wrote, Universal Death Care, a solution for healthcare in the age of entitlement.